I'm a big proponent of ultrasound throughout the field of nephrology. I really think that when you have the first time a patient presents to us, whether in the clinic or in the hospital, we can use the ultrasound for the kidneys, we can use it for volume assessment, we can use it for dialysis access. And where I think it's most useful in the dialysis unit is actually using it to guide our cannulations. If we look at historically, our cannulations have always been done blindly, but with experience. And we look at the workforce around us, especially after the pandemic, and we've seen a lot of turnover in our workforce, and we see a lot more younger, more inexperienced people. And when you look at the criteria, they're more subjective. And I think the ultrasound provides a more objective measure. And so once we can use the ultrasound to look at the axis right at the point of care, right when the patient presents to the dialysis unit, and having taught it to the dialysis frontline staff. So not just us as physicians, but everyone who's taking care of the dialysis patients, if they can use ultrasound and they can use it to guide their cannulations. At least in our center, we've noticed that there is a decrease in infiltrations, and over time that leads to a decrease in catheter contact time and morbidity for our patients. So if we have technology on the end of the creation, like the endovascular AV fistulas, we should definitely incorporate technology at the end user part of it. And using ultrasound does make it, especially the endovascular AV fistula, as you know, the scar is not that visible. They are more low flow fistulas. In our practice, we have some that are right next to the artery. So all of these can lead, if not cannulated correctly, can lead to complications. And so I think having an extra set of eyes and having the technology on our end, having the ultrasound does help to mitigate these complications. We've had patients who have endovascular AV fistulae that I doubt would have been cannulated successfully without ultrasound if they were in another dialysis unit. So I'm a huge proponent of using technology as we are advancing and actually changing the process of care. So if we look at innovations, we've got a lot of innovations in technology. But when we look at the process of care, perhaps that's been stagnant for quite a few years. And it might be a chance to look at what we do and how we do and see how we can incorporate more technology into that and challenge the status quo. Well, I think ultrasound is excellent. I think it is an adjunct to physical examination and experience. So I don't think an ultrasound should replace anything, but the ultrasound in combination with experience and in combination with physical examination, I feel can change the trajectory of what the patient experiences at the end point. And I really feel like everything should be centered towards the patient experience.